Bharati, you can start.
But I feel even if you invest as Royal or Pratishaya,
Om Shri Dhanvantare Namaha. Om Shri Gurudeva. Jignasa is a pan-India movement dedicated to create a unified platform for addressing all dimensions of the Ayush systems, Ayurveda, Yoga, Unani, Siddha, Sova Rigpa, and Homeopathy. The motto of Jignasa is Learn Ayush to Practice Ayush. Jignasa Karnataka stands as a pioneering organization among Ayush students in the state, known for its innovative ideas and impactful programs. We have successfully organized landmark events such as the International Conference and National Arogya Fair in 2018 and 2022, and Yantra 2023 and Manthanam 2024 in collaboration with NAMADS. For the homeopathic fraternity, Unnati 2024 was a unique platform dedicated to empowering homeopathy students. We have actively partnered with the government of Karnataka in Yoga Day celebration, and our flagship event, Achintya Ayurveda, has emerged as a leading conference in the field of Ayurveda across the state. To promote traditional cow-based health practices, we have consistently conducted Panchagavya workshop, training students and practitioners in the preparation and benefits of cow-derived products. Reaching out to underserved and rural area has been a priority. We have conducted numerous health camps, awareness programs, and Swarna Bindu Prashana drives aimed at improving children's immunity. In addition to support Ayush students during their academic journey, Jignasa Karnataka has continuously organized online classes, exam preparatory session, and career and postgraduate guidance program, fostering clarity and confidence amongst graduate aspiring for higher education and professional excellence in the Ayush domain. Now, I'd like to introduce today's speaker, Dr. Lakshmi Patil. Dr. Lakshmi Patil ma'am has been a professor and HOD of the Department of Shalakya Tantra in AMV Hubli. She has 17 plus years of experience. She has completed her UG from Mahaganapati Ayurveda Medical College, Dharwad, in the year 2003 May. She has also completed her PG from Government Ayurveda Medical College, Bangalore, in 2007 April. I'd like to hand over the session to ma'am.
Namaste, good evening to one and all. Am I audible? Namaste, good evening. Am I audible?
Yes, ma'am, you're audible, ma'am. You can start the session, ma'am.
Okay, thank you. Okay, good evening, one and all. Ajnana Timirandasya Jnananjana Shalakaya Chakshurunmritam Yena Tasmai Shri Guruve Namaha. So I welcome all the students from different colleges, all the final year students of BMS, those who are going for the university exams in the month of July or August. So here we have gathered to know about, so this is an online orientation program conducted by Jignasa for the Shalakya 2 paper. Mainly we have been asked to give the orientation for the exam going students of Shalakya 2. So let us begin with the Shalakya 2 paper. Okay, so as you know, the present students who are going for the exams are RS6 batch. They are from the RS6 batch, wherein the Shalakya paper is divided into paper 1 and paper 2. Paper 1 will be dealt by another doctor. So I will be concentrating only on the paper 2 Shalakya. So earlier, Shalakya 2 paper, mainly in RS4 and RS5, see, initially we'll start our discussion with the distribution of marks and how the pattern of the syllabus was. So as you know, Shiro rogas, Karna rogas, Nasa rogas, and Mukha rogas are mainly dealt in paper 2 Shalakya. So now, earlier what happened, RS4 and RS5 batches, the pattern was different and 50 marks totally, as you know, 100 marks for paper 1, 100 marks for paper 2 in theory, and practically it was different. Now it is, so it is amongst the distribution is totally for 100 marks for the practicals, wherein 70 marks are for written theory and 30 will be for your viva. Okay. In that 70 marks, we will be having 30 marks long question, long case sheet. 20 marks will be carrying a short case. Okay. 10 marks for your journal. So 30 marks long case sheet of paper 2, 20 marks a short case sheet, and 10 marks for your journal and 10 marks for your identification. Later on, and you'll be having 30 marks for your viva. Totally 100 marks of practicals marks have been distributed. Earlier, coming back to the syllabus point of view, Shiro rogas, Mukha rogas, Shiro rogas, Karna rogas, and Nasa rogas were for 50 marks. Now it's not like that. So only for under 50 marks, while we were setting the question papers and all, 50 marks we would take the questions from Shiro rogas, Karna rogas, and Nasa rogas, and another 50 marks for Mukha rogas. Okay, presently for RS6 batch there is nothing like that, and the distribution has been, the points have been told, and the same has been covered. Like I would like to start the discussion from Shiro roga concept. Okay, Shiro rogas mainly, as you know, in theory marks. Okay, 10 marks questions, two questions for 10 marks, long essays. Okay, two questions for 10 marks for long essays. Then for 5 marks, 10 questions will be there. These are short answers. Okay, for 5 marks, you'll be having 10 questions. These are short answers. And lastly, you'll be having short answers for 3 marks. So again, for the 3 marks question will be again for, again the 10 questions will be there. Totally it makes 100. So how to attempt each and every question? So how we have to answer a long essay, or it might be a short essay or a short answer. So everybody will have their own techniques of reading. Okay, some will be comfortable to write only the long essays, and some will be feeling comfortable to write the long questions, and some will write the short answers like MCQs. Okay, so precisely speaking, so you have to be very specific, whatever it is, no matter how it is asked. So starting with the Shiro rogas. So what are the contents of Shiro rogas? What you have to study in Shiro rogas? You have to study mainly Shirasaha Uttamangatvam. Your Shiro roga syllabus starts with the point that is Shirasa Uttamangatvam. That is the importance or the superiority of Shiras. That is the main point to be covered. That can be there for 10 marks. Okay, very expected question for 10 marks you can have Shirasa Uttamangatvam. So how we can write? You have to give the references of whatever, wherever Shiras is considered as Uttamanga. Why Shiras is considered as Uttamanga? Different references are there according to Sushruta and Vagbhata and even Charaka. Okay, so those references you have to quote with the shlokas. which will fetch you more marks. Pranaha, Pranabhutam, why it is considered like Indriyas are there and Indriya Adhishtanas are there in the Shiras, as the Shiras is considered Uttamanga or Urdvanga. So why we are giving so much of importance? N number of references will be getting. So you just compile the references and you have to mention the shlokas. Suppose if the student is not comfortable with the shlokas, at least some of the important shlokas, it is actually mandatory to go with the shlokas. If some students will be facing problems to go with the shlokas, at least they can mention the references. Okay, then Shirasa Uttamangatvam, you can write it for 10 marks. Usually that question is asked for 10 marks in paper 2. Then coming to the Sankhya Samprapti or enumeration of the Shiro rogas according to different acharyas. So mainly we are considering Acharya Sushruta and Acharya Vagbhata here for the Sankhya Samprapti or the enumeration. So list out the enumerations how many according to Acharya Sushruta and how many according to Acharya Vagbhata. Charakas also you can mention, and you have to know about Samanya Nidana, Lakshana, Samprapti, Chikitsa and Sadhya Sadhyata of Shiro rogas. So each of this point, okay, each of these can be asked for 5 marks. Okay, so otherwise Samanya Nidana, Samprapti, Lakshana, Sadhya Sadhyata and Samanya Chikitsa of Shiro rogas together can be asked for 10 marks. Or else Saman, as I told you, Shirasa Uttamangatvam is one of the important 10 marks question in paper 2. And one more 10 marks question you can have here is Samanya Nidana, Samprapti, Lakshana, Sadhya Sadhyata and Chikitsa of Shiro rogas. This can be given for 10 marks, okay, in Shiro rogas. Otherwise, you can split. The question paper setter can split these again into 5 marks question. He can only ask Nidana, he can only ask Samprapti and Lakshana, and he can only ask Samanya Lakshana or Samanya Chikitsa of Shiro rogas. Again here, when suppose only Samanya Nidana of Shiro rogas is asked, so there is yukti how the student has to attempt that question. So first you decide what to write and how much to write for that. Any disturbance is there? Am I clear? Clearly audible, is it? Okay, so for Samanya Nidana, how you have to write the Samanya Nidana? So you have to, again you have to come back for the shloka. Again in Charaka the reference is there, Sushruta the reference is there. Like that you have to answer and see, if you are again going for the types of Shiro rogas, Vataja, Pittaja, as you know, you have 11 types of Shiro rogas according to Sushruta, and according to Vagbhata you have 19, wherein Kapalagata rogas are also included. So all the Shiro rogas they can give or they may not give. So enlist the 11 Shiro rogas. They may ask like that. Enlist the 11 Shiro rogas and mention in detail about some Vata Shirishula, Pitta Shirishula. Likewise, they may ask. If particular Shiro roga is asked, like example, Vata Shirishula is asked. Okay, very commonly it may be asked Vataja Shirishula, Pitta Shirishula or Kafaja Shirishula. So you have to mention the specific nidana for Vataja Shirishula. If the student is knowing about Tika, you can mention, that will fetch you more marks. So exact Vataja Shirishula reference, what acharyas are giving, that you have to mention. Yasya Nimitta Rujaha, that shloka is there, no? Sushrutas, that you have to mention. And if you know the Tika, but if you don't know the shloka, it is okay, but you have to write or you have to mention what in Tika, what is the reference given. Okay, the explanation, what type of shula the patient will be having, all the explanations are there in the Tika, that you have to write. Then Vishishta Shiro rogas, speaking about Vishishta Shiro rogas, you have Ardhavvedaka, Shankaka, Anantavata. So only Vishishta Shiro rogas can be given for 10 marks in Shiro rogas. Otherwise, only for 5 marks, again they can divide. Ardhavvedaka, Anantavata, Suryavarta. Likewise, they can divide each and every disease. So if only Ardhavvedaka is asked for 5 marks, you have to mention the Shloka, Nidana, Lakshana, Samprapti and the Chikitsa along with its modern concept also. We have to write the modern concept. So probable correlations are important. So for the concept wise, you learn Ayurveda as Ayurveda and modern science as modern science. So with respect to correlation, to make the student understand, these correlations are being given. So when even if Ardha Bhedaka is asked for 5 marks, you have to cover up all the details, even the part of migraine and headache, any type of headache can be asked. So for Shirogas, headache is very important. Like ICHD, International Classification of Headache Disorders is there. So headache can be asked for 10 marks. Different headache along with it. It is having so many, like it is given like a flow chart. So many types of headaches are there, wherein under the classification it has been included. So those particular headaches which can be taken as the probable correlations for the Shiro rogas, you can add. You have to write about migraine if only Ardhavabhedaka is asked for 5 marks. Okay, then coming to the Kapalagata rogas. Kapalagata rogas again, as according to Acharya Vagbhata, 9 Kapalagata rogas are there, which they can be asked for 10 marks also. Or these Kapalagata rogas, most probably they'll be asking it for 3 marks. Okay, like Indramukta is there, Khalita is there, Palita is there, like Shiro Granthi, Pitaka, likewise, you'll be having it for 3 marks. These are expected. In total, Kapalagata Roga is expected for 10 marks also and for 3 marks also. Okay. Then in a Samanya, this Shiro Roga concept, we have to learn about Murdni Taila also. There are some Chikitsa concepts wherein we have to concentrate. Like in Shalakya Tantra, as you know, there are many Kriya Kalpas mentioned. In paper 1, we are having Netra Kriya Kalpa, and in paper 2, we are having many Kriya Kalpas like Nasya, Karnapurna, Pratisarana, Kavala, Gandusha, and so many. So here, under the concept of Shivarogas, they have to concentrate on the Murdni Taila. So they may ask, Murdni Taila is a common question in Panchakarma also, and they may ask in with respect to Shalakya Tantra also. So what about Shiro Basti? What is the Matra, Shiro Dhara? How you have to do? What is the time given for each procedure? Shiro Abhyanga. What are the indications? What are the contraindications of all the types of Murni Taila? Which is Uttarottara Gunakari. Likewise, it may be asked in theory also, and in the Viva, especially the concepts or the applied aspects of Murni Taila, you have to be prepared with. Okay. So then we are having Samanya Yogas for Shiro Rogas. What are the probable Samanya Yogas? Like you have many, Varanadi Kasha is there, Lakshmi Vilasa Rasa is there, and for some of the Nasya Yogas are mentioned, some of the Abhyanga Yogas are mentioned, some oral utikas or gugulus, tablets are mentioned, and some Taila Yogas are mentioned for Nasya. Lepas are mentioned, Gritas are mentioned, at least 1 or 2 yogas which are particularly meant for. Like when you go for your post graduation, you can read it in a specified manner. This is for this. Whenever you're doing your thesis, we'll definitely go for the specificity for the undergraduation level. But at least you have to know both for theory paper as well as for your Viva. So you have to know the ingredients as well as indications of the different types of yogas, the Samanya yogas which are mentioned for Shiro rogas. Like in Pittadashwareshwara, we go with Lagu Shekara Rasa.
It is there in our group, no?
Lagu Shekara Rasa in Pittadashwareshwara. So you have the different Varanadi Kashaya is there, Varanadi Kshira Grita is there, Mahalakshmi Vilasa Rasa is there, Rasna. So many Gugulu preparations are there. So likewise, you have to know the yogas plus its ingredients plus dosages. Okay, it will help you for your theory paper also and for your practical examinations also. And regarding the modern concepts, you have to, in Shiro rogas, definitely you have to read the headache and its different types. Like you have office headache, tension headache, okay, which you can probably correlate to Vataja, Pittaja, Kafaja, Shirashula and all. Migraine you have to study. Migraine, even in sinusitis you get headache, gastritis you get headache. So headache, office headache, so many types of headaches are there, no? So at least you have to understand the meaning and the classification of different types of headache plus migraine. In detail you have to write if it is asked for, if Ardha Bhedaka is asked for 10 marks. Okay. So now going to the next part of our syllabus, Karna rogas. So are there any doubts in Shiro rogas? Are there any doubts? So if not, I'll move on to the Karna roga concept, which is very commonly seen. The disorders. Karna rogas are the very commonly seen disorders. Even the Karna rogas, if you are studying properly, so many cases you get in your daily OPDs. So again, so before you go to Karna rogas, first of all, each and every student must know, must and should it is to know about the anatomy, physiology, examination part. Then comes the pathological part, then comes the treatment part. Because most of the students will have forgotten the anatomy and physiology part, which they have already studied in the first year. First comes the detailed anatomy. So for your batch, there is no any hard and fast rule that the question paper setter cannot ask the anatomy for your 10 marks. So you may expect or you can expect the anatomy, physiology and examination part for 10 marks also. Okay, so in detailed anatomy of Karna roga, this external ear, middle ear, as well as the inner ear, physiological concepts and the examination part you have to know. Examination part, which shloka should be by-hearted because there are so many shlokas seems difficult. Okay, at least the important shlokas according to Sushruta. Okay, so here you have Vataja Shirashula is there, Pittaja Shirashula. These are the Samanya Shirorogas. Vishishta Shirorogas you can buy. Okay, so you can go with Ardha Bhedaka. Vataja Shirashula is important. Pittaja Shirashula is important. Kafaja Shirashula is important. So you may not see Kshayaja and Krimija Shirashula as commonly as we see Vataja, Pittaja and Kafaja. Okay, so you can memorize Vataja Shirashula, Pittaja Shirashula, Kafaja Shirashula, then Ardha Bhedaka and Anantavat. Okay, here. And in Kapalagata rogas, you can go with Khalitya and Paritya. Darunaka is there. Very commonly asked. Even in your Viva, they will be asking about the Kapalagata rogas. Khalitya is there, Darunaka is there, Palitya is there. These three very frequently they will be asking about. Okay, these shlokas you can memorize. Okay, continuing with the and under the concept of Shirasa Uttamangatvam Pranaha Pranavrutam Yatrashitaha Sarvendriyani cha. That shloka. Okay, which is giving you which is telling you the importance of the Shiras. Those shlokas, why it is considered as important. So those shlokas you can memorize. Coming back to Karna rogas, I was speaking about the anatomy, physiology and examination part. So this part, only anatomy and physiology, anatomy of whole ear they can ask. Or they can ask only middle ear. Or they can ask only internal ear. So in general, for 10 marks question, they'll compile. I think they'll not be specific. So for 10 marks, they may ask only write about anatomy of ear. Okay, that is the long essay question. So here you have to write. If you know the diagram, it is well and good if you write a neatly labeled diagram. That is most expected from the evaluators, that you know at least the anatomy of the ear, how you have read about the anatomy. That will show the examiner that you have read about ear something and you know about the ear something. Okay, external aortic canal. What are the parts? You draw the diagram of the ear and you name the diagram. Neat label diagrams are expected in the anatomy, wherever the anatomical parts are asked. Okay, so they may then coming to the examination part, very important because it is Karna is considered most commonly and in practice you are getting the routine cases of Karna. So definitely you have to be thorough with the examination part. Under the examination of ear, you have otoscopic examination. You have the functional, like you have Valsalva, like the patency of the Eustachian tube. The test to check the patency of the Eustachian tube, you have Valsalva manor. Okay, and tuning fork test, very, very important clinical hearing test at your OPD levels. Even after completion of your UG, you can practice the tuning fork test. Okay, every patient you cannot send for the audiometric examination. So if you are at your OPD and you want to diagnose what type of hearing loss it is, grossly you have to go for clinical test of hearing, that is tuning fork test. So you have to be perfect with the otoscopic examination. So otoscopic examination can be a definite question for 5 marks. So what is otoscopic examination? What are the instruments they are important. What instruments you are using for otoscopic examination? Okay, and what is the limitation of the otoscopic examination? Till what you are going to see with, if suppose you are doing an otoscopic examination for a patient, what is the limitation? Till what part, what extent of the ear you are able to see? Okay, that you have to be perfect whenever you are sitting in your viva. Okay, theoretically, otoscopic examination point by point, so many points have to be covered. So what you are going to write in auditory canal and what in tympanic membrane, what you are seeing. So 5 marks question, you have to elicit all the different. First you can elicit the normal tympanic membrane and the normal auditory canal, how it is seen through an otoscope. Then you can come for the abnormal part or the pathological conditions, different types of pathological conditions, like you have impacted wax, you have tumors, you have debris, you have secretions in the ear. Then your tympanic membrane, you very commonly seen is perforation is there, bulging of tympanic membrane, thinning is there. Okay, different types of clinical conditions. If you are writing in your examination, that means that will tell the examiner that this student has read and this student is having some stuff, so that we can openly give, we can give the marks. Okay, the expected marks the student can get. Okay, this was about the anatomy, examination. You can go with otoscopic. Okay, otoscopic examination. Then tests to check the patency of the eustachian tube, Valsalva manor, then Toynbee's test and tuning fork test. These are the important clinical tests to be known in ear. Okay, then coming to the different types of instruments and the equipments, what you should know with respect to the ear. So you know, you have oral syringe is there, probe is there, Jobson's horn probe is there, otoscope is there, oral speculum is there, crocodile forceps is there. So which instrument you have to first identify the instrument, then you have to know at least it's one indication. So while everybody must have seen the otoscope. So with the otoscope, again, what is required? So once the patient has undergone the otoscopic examination, the patient might need a probe. Suppose that it is a case of impacted wax and the patient wants to undergo manual removal. Okay, the person should have a probe. Jobson's horn probe should be there. Then scoop, okay, or wax hook it is called. Then you must have this one, oral syringe, whenever syringing is required. These are some of the, and very important to start with the ENT examination is head mirror you have to have. LED head mirror, commonly all are using now. Earlier, the head mirror was used with a bull's eye lamp. Now bull's eye lamp and the head mirror has been replaced by the LED head mirror. So you have to identify all those instruments. Okay. So coming to the theoretical part, what you have to see again, you have to know the Sankhya Samprapti or the enumeration of Karnagata rogas according to acharyas, different acharyas. As you know, there are 28 according to Acharya Shushruta and 25 according to Acharya Vagbhata. It's better if you know Charakas also. Okay, then again the same thing. Samanya Nidana, Samprapti, Lakshana and Chikitsa. Samanya Chikitsa of Karna rogas. Detailed explanation has been given by Sushruta in Uttara Tantra. Again, the same question can be asked for 10 marks also in the year. Suppose if the examiner doesn't want to ask anatomy for 10 marks, he may ask Samanya Lakshana or the Sankhya Samprapti, that is the enumeration of Karna rogas, Samanya Nidana, Lakshana, Chikitsa and some common yogas with respect to Karna rogas they can ask. So along with all these, be perfect with these shlokas. These are mandatory. Samanya Karna roga nidana avashyaya jalakrida karna kandu yenermarut. Okay. Samanya nidana and samprapti. Lakshana is there. And the chikitsa is there. Okay. And specific chikitsas for Vataja Karna Shula and all. Some of the important chikitsa sutras have to be memorized. Nidana Samprapti and this Chikitsa Sutra is you have to memorize. Okay, and even the Sankhya Samprapti of the Karna rogas according to Sushruta has to be memorized. Karna Shula Pranadascha Badiryak Shvedaivacha, that shloka from Uttara Tantra, that has to be memorized. Again, the detailed explanation, like if a single disease is given for 5 marks. So Karna Shula is there. Karna Shula, Pranadascha, Badiryam, Shvedaivacha, Karnasrav, Karnakandu, Karnavarchas, Tathaivacha. These all are very important clinically seen ear conditions which you can expect them for 5 marks. Okay, under Karna Rogas, for 10 marks, you can expect anatomy or examination part or Samanya Nidana Lakshana and Samprapti plus Chikitsa part. For 5 marks question, you can go with all these particular diseases. Like, for example, if Karna Shula is given, okay, Karna Shula is given for 5 marks, how will you write? Karna Shula, you have to write the shloka, you have to write the reference. It is mandatory that you have to write the shloka with its reference, then you write the meaning, okay, then you can explain the same. Okay, so Nidana, why it is there, and Lakshana, Chikitsa, what Chikitsa has been specifically mentioned for Karnashula. So again, the different categories are made. So Karnashula is single disease by Acharya Shushruta, wherein Vagbata is giving you Vataja, Pittaja and all, no? So there, if the same Karnashula is asked for 10 marks, there lies the difference how you are going to answer a 10 marks question and 5 marks question. So if the same Karnashula has been asked for 10 marks, your answer should be in a detailed way. So both what Acharya Shushruta is mentioning and what Acharya Vagbata is mentioning about all the types of Karnashulas and the treatment protocols which have been mentioned by Acharya Vagbata for all types, they have to be written. Otherwise, if it is for 5 marks, only write the concept of, you can only write the concept of Karnashula according to Acharya Shushruta, then it's Chikitsa, Karnashula Chikitsa, Samanya Karnashula Chikitsa only you can write. Then even Vataja, directly he is not classifying, but he still tells Vataja Karnashula Chikitsa and all. So that you can mention, but don't forget to write about otalgia. So otalgia, what is otalgia? Pain in the ear. It is called as otalgia. Okay, even if Karnashula is asked for 5 marks, the modern concept you have to write. Modern concept of otalgia. So what is the cause of otalgia? What are the general causes? What are the local causes? And what are the referred causes? So here only you can expect more questions. Even in a simple condition of otalgia, you can expect more questions, more and more questions for 3 marks also. So here comes the rule of T5. So what is the rule of T5? So that can be a case, sorry, that can be a question for 3 marks. So it is nothing but what it is there. These are the referred causes of otalgia, from where the pain in the ear, what are the referred causes of the pain in the ear. So there comes the rule of T5. Okay, likewise many other clinical conditions are there. Like I gave an example of Karnashula. Similarly, Nada is there. What is the difference between Nada and Shveda? Frequently this question is asked. Okay, so what is Karnanada? What is Karnakshveda? Shlokas are there. So each and every disease, okay, each and every disease, actually it is mandatory to go with the shlokas. Then only you will have an idea, a complete idea regarding the disease. Otherwise, it will be later on very difficult to understand the concept. Later on, when a question paper is there in front of you, you'll be like, mum, you cannot, it will be like, you'll be like blind. Okay, some everything will appear blank. So don't do that. You have to be confident. To gain that confidence, it is better to go with the shlokas forever. Okay, so again you have the same Karna Shula Pranada. Pranada or Karna Nada is there. Again, what Karna Nada, what is the concept told by Shushruta? What, how you can treat it, the Chikitsa Siddhanta or the treatment protocol mentioned, and Samanya Siddhanta is there for Karna Rogas. That you can mention. Then the modern concept of tinnitus has to be studied. Okay, the modern concept of tinnitus has to be included in Karna Nada. Okay, so the other modern topics, if you want, you can note down what are the modern topics to be studied under Karna Rogas. You have to study otalgia, you have to study tinnitus, and you have to study about labyrinthitis. You have to study about hearing loss or deafness. Okay, complete what are the degree of deafness and all. What is the definition of deafness? What is the degree of hearing loss? Mild, moderate, severe, Okay, these are the modern concepts to understand in the Karnagata Roga concept. Okay, deafness is there, and CSOM is there, chronic suppurative otitis media. ASOM, acute suppurative otitis media is there. Then you have impacted wax is there, very commonly seen condition, Karna Gutha. Okay, so impacted wax is there. Then you have otomycosis, fungal infection of the ear. Otomycosis you have, then you have otosclerosis. Okay, very important cause of hearing loss, mixed type of hearing loss. You have otosclerosis, you have Meniere's disease. Okay, Meniere's disease. Then you have vertigo, impacted wax is there, vertigo is there. So these are the very East Asian catarrh. So one of the, to understand the middle ear pathology, wherein the East Asian tube plays a major role. So you have to understand the concept of East Asian catarrh under the heading of Karna Pratinaha. Okay, these are all the modern concepts to study. And along with these, you have to study some of the complications of the said diseases. Like example, very commonest complication of CSOM is cholesteatoma. So these are the common terminologies which you have to be acquainted, because immediately after clearing your final exams, you will be going for your internship. Okay, where you are posted in different OPDs and you have to know the modern concepts. If you are not aware of these terminologies, it becomes very difficult to cope up with the patient. So it's all these are the common modern points you have to know in your undergraduation. I'll repeat it once again. The otalgia, tinnitus, then hearing loss or deafness, okay, types, degree and all. Then CSOM, ASOM, otomycosis, impacted wax, otosclerosis, Meniere's disease you have, then vertigo you have, East Asian catarrh, and the complication cholesteatoma, you can refer. Then you have to going for the surgical part, like under Karna rogas, you are going to get different terminology surgical, like they can be asked, even asked for 3 marks, like you have tympanoplasty, tympanotomy, myringotomy, myringoplasty, different types. They will not ask for 10 marks usually. They may ask for 5 marks. What is tympanoplasty? What are the types of tympanoplasty? What is myringoplasty? Difference between myringoplasty and myringotomy. What is myringotomy? Likewise. Okay, then you have puncture. Okay, the puncture of the tympanic membrane. Different types, grommet insertion and all. You have to know certain points regarding surgical intervention in Karna rogas, because it is even important under practical examination during your viva. Okay, so that is the part to be dealt. And again, Sandhana karma is mentioned. One of the very important point to be noted is Sandhana karma, because Acharya Sushruta mentions in detail about Karna Sandhana and Asa Sandhana. Okay, they have to be studied. So if it can be asked for 5 marks, rhinoplasty and oroplasty, that is which has been dealt in Sushruta Sutrasthana. So that can be asked, Karna Sandhana and Nasa Sandhana. Okay, so this was, and again coming back to the yogas, what are the common yogas? As I have told in Shiro Roga, the same concept has to be studied here also. The Samanya yogas, like you have orally, Rasnadi Gugulu is there, Trifla Gugulu is there, Gandhakarasayana is there, then certain tailas you have for Karna Purana, Akshara taila is there. The ingredients and indications, very important. Okay, so commonly they will be asking Kshara taila and Bilvadi taila, Nirgundi taila, likewise. Okay, for those the tailas which are directly indicated in Karna Purana under different clinical conditions, they will be asking some of the Ghrita, as you know, Samanyam Karna Rogeshu Ghritapanam Rasayanam. So Rasayana, some of the Rasayana yogas you have to know. What type of Rasayana can be given? At least theoretically, when they are asking it for 3 marks, you should be able to write. Okay, some Ghritas. Okay, Snehapana is mentioned under the Samanya Chikitsa of Karna Roga. So Ghritas, some of the Ghritas have to be mentioned, and the Kriya Kalpas, the procedures which we routinely do in our OPDs, like you have Karna Purana, Karna Dhupana, Karna Pichu, Karna Prakshalana, Karna Pramarjana. These are the very important Kriya Kalpas which we are doing in Karna concept. Okay, Karna Dhupana we do, Karna Purana we do, Karna Prakshalana, Karna Pramarjana. What is the difference between Karna Prakshalana and Pramarjana? Karna Prakshalana is nothing but the syringing, oral syringing, what we call. Okay, or ear wash, okay, or ear toilet we call. What is Karna Pramarjana? Dry mopping. Pichu Kurchikaya Karna Pronchanam. Likewise, the reference is there. Pichu Kurchikaya Karna Pronchanam is after Karna Prakshalana, we are going for Karna Pramarjana, wherein we are using some varti, like some cotton we are using, and we are mopping the ear dry. That is called as dry mopping. Karna Pramarjana. And Karna Pichu, even the reference of Karna Pichu is there. When the patient is complaining of too much of pain in the ear, to give the relief, okay, what we do, we can take the patient for Karna Pichu. We can take any Vatahara Taila and we can dip it and we can pack it. Okay, we can pack in the ear canal. That is called as Karna Pichu. Okay, see, these are the common treatment protocols what we follow in Karna Rogas. We have to know about these procedures also, because regarding Karna, they can be asked in your theory as well as in your Viva. Theoretically, again, types you have to study. So Karna Purna, what is the indicated matra, at what time we have to keep, all the references there, it should be studied. Okay. Then moving on to Nasa Rogas. Any doubts in Karna Rogas? Any doubts in Karna Rogas? Samanya Lakshmana of Karna Roga is only Shula. The Samanya Lakshana is there with different context they are explaining. Samanya Lakshana is there in different context. Okay, Karna Shula, though it is the common for undergraduation, you can take it as Karna Shula. Okay, you can be thorough with the Karna Shula shloka. Okay, then coming to the Nasa Roga, again the same detailed anatomy. Should we study all those Karna? Yes, it is. If you can do, it's very well. So if you can study all the Karna shlokas, yeah, Sivataja, Pittaja, Karna, Raktaja and all. Say if everything, all the shlokas you cannot memorize, at least go with Vataja, Pittaja, Kafaja, Sanipataja and Raktaja. Okay, so the important Karna Shula shlokas, at least Vataja, Pittaja and Kafaja you have to memorize, and the other shlokas, like whatever they have given for Karna Shula, according to Sushruta, then according to Karna Nada is there, Karna Pratina is there, important Karna Rogas, okay, Karna Paka is there, they can be given for 5 marks. If you are not able to do the particular shloka, at least understand the meaning, write the meaning and write the reference. Okay, if you are feeling difficult to go with the shloka, all the students will not be familiar with the shlokas. So it's better each and every student start memorizing the shlokas once they enter your BMS curriculum. Okay, otherwise it will be very difficult. Deepika Taila, somebody is asking. Yes, Deepika Taila is mandatory shloka. Mahataha Panchamulasya, Kandam Ashtadashangulam. That has to be studied because it can be given for 5 marks or 3 marks. Some are directly mentioned. Deepika Taila, Sadhyo Grunnati Vedanam. The reference is there, no? Whatever is there in this Ayurvedic correlation. Yes, write about Ayurvedic correlation. Modern disease is asked. See, vice versa it goes. If the modern disease is asked, it's better to write first completely you have to write the modern correlation. Then if time permits, it is not actually mandatory to write the Ayurvedic concept. So how it is mandatory to write the modern concept if the Ayurveda disease is asked, it's actually not mandatory. Whatever is asked that you have to write the modern. Like suppose if the Karna, if complete otalgia is asked, so otalgia completely you have to write regarding otalgia. Then if time permits, you can write a note below and you can write this condition of otalgia can be clinically correlated to such a condition which has been mentioned in our text. Likewise, you can give the reference. So very shortly, you can write the Ayurvedic part. But whatever is asked, you have to be more specific regarding that question only, that particular question only. And regarding shlokas, Sandhana Vidhi. So what type of Sandhana Vidhi? Karna Sandhana is there. All the points in Sandhana Vidhi, Acharya Shushruta, how is asking us to do the Sandhana Vidhi, no, the points are mentioned. So the points, according to the points only you have to go. So what type, what are the Purva Karma, Pradhana Karma, Paschat Karma? Again, under Pradhana Karma, he is mentioning the points. Na? What type of incision to be taken. Point wise, you have to write the Sandhana Karma. Okay, coming to the Nasa Rogas, same regarding the Nasa Rogas also. So CSOM and OSO, yes, of course, it can be correlated to Karnapaka. CSOM can be directly correlated to Karnapaka. Okay, and some of the conditions of mid-layer effusion. Mid-layer effusion is there, and OME is there. Okay, otitis media with effusion. That is also there. Okay, yes, Karnapaligata rogas are important. According to Sushruta, you have, according to Vagbhata, he has mentioned so many Karnapaligata rogas, even that can be asked for 10 marks. Only Karnapaligata rogas can be asked for 10 marks. Okay. Okay, now moving to Nasagata rogas. Again, you have to write the detailed anatomy, physiology, and examination part. Karna Sandhana, somebody is asking, write in completely. So my given topic is I have to make you exam oriented talk. Okay, so if I go with go in detail with Karna Sandhana, I cannot complete all the Mukha rogas as well. Okay, I am here to tell you what to write in your exams. So particularly to orient you for the writing of, where to refer modern concepts, any suggestion. Okay, so to refer the modern concepts, you go with the ENT book. P.L. Dingra is there. P.L. Dingra is a good book. Okay, wherein you get all the modern concepts, and even Bhargav is good for UG, for ENT. Okay, so don't write. My sincere suggestion is don't read the Ayurvedic compiled textbooks wherein they'll club both, except some books. Okay, all books, compiled books, you can refer the Samhitas for Ayurveda part, and the to read the modern diseases, you refer the modern books. Don't read the compiled books. So during your exams, it's okay. So you'll not be having much time. So just for your glance, okay, for just to have a glance, you can go with the compiled textbooks. But to have the proper knowledge of Samhita and the proper knowledge of the rogas, whatever you have given, you have to study. So read the rogas under the Samhita only, in the Samhita only. Okay, the modern text also you can refer. Okay, coming to Nasa Roga, again same. Anatomy, physiology, examination part. So unless and until you people are perfect with the anatomy, physiology and examination part of the nose. So how the nose is divided. External nose you have the nasal cavities, and you cannot read the pathology, because so many diseases we have to again club and read. We have to correlate each and every disease to understand the disease as a whole. If we are not knowing the anatomy, it will be actually very difficult for the student to undergo viva or the practical examination. So many students will be good in theory. They'll read the theory books, but they are not exposed to the patients. That is the main problem what the students are facing. If you have not seen any case of DNS or hypertrophy of the turbinates, it will be very difficult for you to understand what is the concept of Nasa Naha. Okay, likewise, read in detail about the anatomy, physiology, examination part, especially with respect to examination part of nose. You have to read the anterior endoscopic examination, posterior endoscopic examination, and the PNS examination, that is the paranasal sinus examination. Examination of nose and PNS. You have to start. How you have to start to read Nasagata rogas? Before you start Nasagata rogas, be thorough in these aspects. Okay, you have to read the anatomy, physiology, examination. Under examination, don't only read the nose. You have to read examination of nose and PNS, paranasal sinus examination. And there are certain functional examinations of nose, like you have Cottle test, you have cold spatula test. Okay, these are the functional tests of the nose. That also you have to read. So that will be helpful for you in the Viva. Okay, this can be also asked for 10 marks in your theory examination or anatomy or physiology. For examination of nose, or write the complete detailed anatomy of the nose, that can be also asked for 10 marks. And functional tests of nose can be asked for 5 marks. Okay, functional test, Cottle test is there, cold spatula test is there. Okay, these tests can be asked for 5 marks. Cotton wool test is there. Okay, then coming to the Sankhya Samprapti. Again, Sankhya Samprapti and enumeration. Like Sankhya Samprapti of all the rogas, it is mandatory. Sankhya Samprapti of Shiro rogas, Nasa rogas, Karna rogas, the shlokas are mandatory. Even here, Sankhya Samprapti of Nasagata according to Sushruta. Okay, Api Nasa Puti Nasa Nasa Pakas Tathai that shloka is there, no? That has to be read completely. Again, according to Vagbhata. Okay, you read the Sankhya Samprapti shloka according to, you can memorize the Shushrutas shloka, but you have to remember the concept of Vagbhata also. Okay, then again Samanya Nidana, Lakshana and Samprapti. Again here in Nasagata you are getting you have to add the Samanya Nidana and Samprapti of Pratishaya also. That has to be taken care of because Pratishaya is one of the important Vyadhi to be read here. It can be given for 10 marks also, for 5 marks also, for 3 marks also. Pratishaya is a very vast Vyadhi which is mentioned in our Samhitas. Both the Acharyas have contributed a lot to explain Pratishaya. So Samanya Nidana, Samprapti and Lakshana of Pratishaya is there. Dushta Pratishaya is there according to Vagbhata. So what the concept is there? So what you have to read? So grossly to understand the diseases. What Acharya Shushruta has told, what Acharya Vagbhata has told, what are the similarities between the two Acharyas, what are the differences between the two Acharyas. Mainly you concentrate, you should know about Charaka also, but you mainly concentrate on Acharya Shushruta and Vagbhata, who has told what, and what are the similarities and what are the differences to be remembered by you. There are many concepts like that. So this has Shushruta has explained, this Vagbhata has explained, some so and so both have explained. Likewise, many of the rogas you are going to see. So that is one of the important point to be remembered. Okay. Then Pratishaya, with respect to modern modern correlation, you have to know about infective type and allergic type of rhinitis. Okay, infective type and allergic type of rhinitis, rhinosinusitis. Sinusitis also you have to study, acute rhinitis, chronic rhinitis, whatever the rhinitis has been explained in modern science. There are different types of rhinitis are there. Okay, but at least you should know what is meant by what, and this is this type of Pratishaya I can correlate to this type of rhinitis. That you should know. Okay, many of the acute rhinitis is there, chronic ischemic type of rhinitis, chronic rhinitis is there. Okay, so what are the main differences between the acute rhinitis and what are the presenting complaints? If you have seen the patients, the students who have seen the patients, they'll very well understand the topics because they would have seen the case and then they'll read the Samhita so that it will be very perfectly set in their minds. Okay, so here this is acute rhinitis, this is chronic rhinitis. Again, what is the classification of rhinitis? What is the classification of sinusitis? What is infective rhinitis? What is allergic rhinitis? Because you have Kshavatu and Bhramshatu. Kshavatu is there, no? There you have to read both the allergic rhinitis as well as vasomotor type of rhinitis. Okay, then you have to know about this furuncle. Furuncle is very important point to be studied under modern, both in Karna as well as in Nasa. Okay, even nasal furuncle, then you have to understand what is atrophic rhinitis. Again, this can be asked for 5 marks. These are all the 5 marks questions. Okay, types of rhinitis, allergic rhinitis, vasomotor rhinitis, atrophic rhinitis, epistaxis. Nasagata Raktapitta, the concept is there, no? There you have to read about epistaxis. Then, very importantly speaking, you have to read about DNS, deviated nasal septum. Okay, so what are the types of DNS? Again, Arsha is there, that is nasal polyp. In detail, you have to read about the nasal polyp. Okay, and coming to the Ayurveda part, so Apinasa is there, Putinasa is there, Nasa Paka, Shosha, Srava, so many of them are there. Actually, by the rule, you have to know the shlokas. By the rule, you should know the shlokas of each and every disease. But if you feel it difficult to memorize all the diseases, at least you have to use the Sanskrit terminologies, whatever acharyas have used while explaining the shlokas, and then write the reference. Okay, so if you are not able to remember all the shlokas, so at least use the same terminologies. while you are writing your answer paper, you use the same Sanskrit terminologies in your paper and you quote the references. So seeing that, the evaluator will feel that yes, the student has read it, but he is not able to reproduce the shloka. Okay, so it is a very easiest way what you can do. You mention the same Sanskrit terminologies whatever acharyas have mentioned. Okay, so again, a modern concept you have to read nasal polyp also, DNS also, and turbinate hypertrophy that will be included under different types of rhinitis only. On examination, what will be seeing, what you will be seeing, so and so. So surgical again here there is surgical intervention wherein you have to know about SMR and septoplasty. Okay, the surgical intervention is you have to know about SMR, submucous resection, and septoplasty is there, and polypectomy you have to read, and FES you can see. Okay, what is first function endoscopic sinus surgery? You should know about FES, you should know about septoplasty, and mainly polypectomy and this SMR. These are the important. So in sinusitis, they'll be having the puncture also, the maxillary sinus puncture, that also, or the antral wash, what they call that. The concept of the antral wash also should be known for your practical examinations. Okay, then coming to the instruments whatever you can use during nasal examination. So you should be familiar with the nasal instruments. You have to do anterior anoscopic examination, you go with the tudicum speculum. You should have a posterior anoscopic mirror. You should have a tudicum speculum, and that LED head mirror is common for all. Okay, and crocodile forceps, from which you can take out a foreign body from the auditory canal. The same you can have it in the nasal cavity also. So the knowledge regarding very important instruments which can be used for your clinical examination, that has to be known by the student, because under the identification of instruments, the instruments will be kept and you have to identify it correctly. Okay, and coming to the again coming to the common yogas. Okay, commonly used yogas clinically, what the yogas are being practiced, it might be a guglu or vati or churna or taila, whatever it is. Okay, like haridra kanda, so many pratishaya yogas we are using, no? Mahalakshmi Vilasa rasa is there, Tribhuvan Kirti rasa is there, Mrutyunjay rasa is there. Very commonly we use tailas, anu taila, shadbindu taila, bala taila, kshira bala. Okay, for nasya we are using so many preparations, and we are having churna preparations like Rajanyadi churna is there, Haridra Khanda is there, Sitopladi churna is there, Talisadi is there. So how the yogas are mentioned, under what context, and what is the Anupana and what is the Matra for that yoga. At least that common basic concept has to be known by the student, because when the student is appearing in the Viva examination, see, so many students will be lacking in answering what they have written in their answer paper itself. Okay, just don't read the cases like theory. The theory is meant to understand the practical aspect of it. If you have not seen the practical cases, it might sound difficult, but those students, those who have already seen such cases in their OPDs, they should write it. Okay, and it is mandatory to do the shlokas also for to go through to fetch more marks in the theory paper. Okay, if you are writing the clinical part and the in the Samhita part you are mentioning the shlokas, you will no doubt you will fetch more and more marks. Okay, and the yogas, as I told, you have Anutaila, Shadbindu Taila, and Bala Taila, and the Churna yogas, Vati yogas, Guglu preparations are there. These are the common yogas which you can go for NASA. And Nasya, regarding Nasya, you have to study Nasya, and Nasa Pana is there. Though there is no direct reference of Nasa Pana, they may ask it because everywhere Nasa Pana is run under practice nowadays in the OPDs. Okay, so that concept of Nasya, mode of action and all, you'll be studying in Panchakarma, but here you have to know so from where the medicine is getting absorbed through. So while doing Nasya, suppose this will be, you will have to study this in Panchakarma, the mode of action and all. So nasya, what types of nasya? What type of nasya is indicated in which type of nasagata roga? That reference you should know. Okay. Now coming to mukharogas. So mukharoga is one of the major part in paper 2. So Shiro, Nasa and Karna is over. Coming to Mukharogas. As you know, Mukharogas are divided into Saptayatanas. So basically, you should know how the Mukharogas are classified and how they have been divided into Ayatanas. Oshtha, Danta Mula, Danta, Talu. Likewise, they have been divided. No? Again, you have to know the anatomy. Here, again, anatomy is more to study. The anatomical part is more to study in Mukharogas. Because to understand the complete concept of Mukharogas, Mukha consists of Saptayatanas. And you should know the anatomy, physiology, examination, then the pathological aspects of total Saptayatanas. Okay, you should know the anatomy of lips, okay, teeth, tongue, gingiva, mucosa, okay, total the buccal mucosa, then you have pharynx, then you have larynx, then even the salivary glands and the thyroid is there for your syllabus. Okay, even you should know the anatomical part of salivary glands also. So they may be asked for 5 marks or even only anatomy of teeth or tongue. Okay, anatomy of teeth and this dental formula is very commonly asked under 3 marks question. And there are many areas in the throat which can be asked for 3 marks questions. Like to know the first, if you have already studied the complete anatomical part, whatever the areas I am speaking about, you might understand. If you have not read it, please go back to anatomy and first you properly read the anatomy and then you'll understand the pathological concept. Okay, so you have areas like retromolar. What is retromolar trigone? That can be asked in your Viva also, or 3 marks question also. Okay, leave apart the pathology part. The disease part, very important. Okay, I am aware. Okay, the disease part is very important. Okay, the pharyngeal area is there. Okay, what is the, you have different layer parts in the oropharynx also. What is Waldear's ring? What is retromolar trigone? Okay, and what is peritonsillar abscess? The disease part I am speaking about. Pharyngeal space, retropharyngeal space, retromolar trigone, Waldear's ring. These are certain anatomically important part in your Mukha. That has to be read. And coming to the, again the same thing. Samanya Nidana, Lakshana, Samprapti and Chikitsa of all Oshtha, Danta and Dantamula. Again for each Oshtha, Danta, Dantamula, Sushruta is telling one number, Acharya Vagbhata is telling one number. So know the difference. First you read the Sankhya Samprapti of both the Acharyas. Then you know the difference, what is the difference between Sushruta and Vagbhata. Mainly in the Sankhya Samprapti. Okay, then you have to know something about Oshta Sandhana also. Oshta Sandhana Vidhi, no doubt it has not been explained so in such a detailed way, but whatever the Purva and Pradhana Karma is mentioned, that remains the same. And as I told you, study of salivary glands is also there. And under the modern concept of Mukharogas, very commonly asked questions are Krimidanta is there. Okay, Upakusha, Krimidanta, Shitada, Tundikeri, these are very commonly asked questions for 5 marks. Krimidanta is there, Upakusha is there, then Shitada is there, Bhanjanaka, Dantaharsha, okay, Bhanjanaka is there, Dantaharsha is there, then Oshta Prakopa, commonly asked for 5 marks, all types of Oshta Prakopa, okay, then Oshta Vyadis can be asked for 10 marks also, Jivhagata Rogas can be asked for 10 marks. All the Jivhagata, only 5 are there, Pancha Jivhayam. So all the 5 can be asked for 10 marks or only single Adhijivika or Upajivika or Alasa can be asked for 5 marks. Okay, coming to Danta Moolagata Vyadis, you have Shitada and Upakusha. Commonly, Danta Moolagata Vyadis are asked for 5 marks questions. Okay, and with respect to their modern correlations, you have periodontitis, you have abscess is there, periodontal abscess is there, periodontitis is there, caries tooth. Very importantly, you have to study all the pathological part of Krimidanta. And you have Danta Harsha can be given for 5 marks. That is dental hypersensitivity or tooth hypersensitivity, what you can call. That can be asked for 5 marks. Okay, coming to Kantagata. So you have so many Arbuda part is there, Mamsatana and all, they can be asked for 3 marks. But the clinically commonly seen conditions such as Tundikeri or you have Kanta Shaluka, Tundikeri, they can be asked for 5 marks. Okay, 5 marks, very important questions. They'll be asking Tundikeri, Krimidanta, Upakusha, Shitada, Bhanjanaka, Dantaharsha, very commonly asked. Okay, then you have to go again for the surgical concepts, whatever have been explained in Mukharogas. You have to know about, mainly you have to know about this one, tonsillectomy as well as adenoidectomy. Okay, the procedures, what should be the patient's position and all, that has to be seen. Adenoidectomy and tonsillectomy are the frequently asked questions for your Mukharogas. Then again, Kriya Kalpas, whatever you are going to do here. So again, Nasya stands common. Then you have Kavala, Gandusha, what are the types and all. Kavala, Gandusha can be asked for 5 marks also. Okay, 5 marks definitely. The types of Kavala, types of Gandusha, Pratisarana is there. These are the commonly expected questions in Mukharogas. And the modern part, you have to study gingivitis, periodontitis, periodontal lapses, and herpes zoster related, the oral issues related to herpes. Then you can see the oral submucous fibrosis, lichen planus, erythroplakia, very commonly seen conditions. They can be asked for 3 marks. Okay, so if you are not undergone or if you are not went through all these modern terminologies, you just be acquainted or be familiar with these topics. Okay, and related to treatment part, you have to know about tooth extraction. Okay, what is the technique of tooth extraction and RCT procedures. Root canal therapy, you have to know, you should know what is root canal therapy, what is a tooth extraction therapy, and tooth extraction which is done, which is mentioned in our science, giving no anesthesia. Okay, using Jalandhara Bandha, we are extracting the tooth. Such type of the concept has been mentioned in our science that you have to study. This is the overall coverage of paper 2 syllabus. I hope it was somehow it was useful for you people, and I wish all the students best of luck. Okay, best wishes for your examination. Be confident, do not be afraid. Okay, start your career after start practicing Ayurveda only. Okay, be clear that you will practice only Ayurveda. That will happen only if you are in the habit of reading Samhitas. I wish you all the best, and I would like to conclude here. And I also thank the organizers of Jignasa Karnataka, the whole Jignasa Karnataka team. And I also would like to specially thank the professor of Department of Panchakarma, Dr. Padmavati Madam, for giving me an opportunity. I'd like to conclude here. Thank you one and all.
Thank you so much, ma'am. Thank you, ma'am, for your insightful and engaging presentation. We deeply appreciate the time, effort, and clarity you brought to the topic. Your knowledge has truly enriched our understanding and sparked curiosity within us. It was an honor to learn from your experience and expertise. Thank you so much, ma'am, for sharing your valuable insights. Thank you.
Thank you.